mechanical involvement, or if perhaps there's, that is where you would find a tumor or something like that would be in play. And then the blood work would then, give you information regarding to sedimentary rate and what types of things could be involved with that. Treatment options. According to the American Medical Association, the treatment options for sciatica and restless leg syndrome are very, very common. Physical therapy, exercise, rehabilitative things are the primary intervention for these things, and not only are they're the most accepted, but they're usually the most beneficial. Drug intervention for this would be non-steroidal anti-inflammatory drugs, your muscle relaxants, antidepressants, anticonvulsant drugs. So basically, we're going to deflame it and get it calm, make the muscles be relaxed around it. And we're going to give you enough medication so you don't care. And then, if that doesn't go, then the path then follows epidural injections, is where they actually take a shot, put it into the central nervous system in the epidural sac, bathe that area in a corticosteroid, creating a decreased symptom down the nervous tract from there. And then the last option then would be surgery, where you would either have laminectomy, discectomy, those types of things, which is always the last case scenario. So as we look at the anatomy associated with the sciatica, restless leg syndrome, what we're talking about is you have the pelvic girdle, the tailbone of the sacrum in the center, and you have the nerves that follow down the leg associated. We talked about the piriformis. It's a muscle that attaches along the lateral border of the sacrum, attaches to the greater trochanter of the femur, and it runs across this way. Well, there is that sciatic nerve, so you literally have mechanical forces pressing down upon this nerve, and that can create the sciatica, the restless leg, the things like that. It makes that leg not want to function in a normal way. You'll have the lumbar and sacral plexus, which is when the nerves exit the spine and come out and they form this big sciatic nerve that goes down the posterior of the leg. You can have disc involvement in here that push against this nerve root, creating diminished nerve energy going on down from there. You can have sacroiliac joint, SI joint involvement, where you have pressure put along this moving part of the body that allows pressure to be put upon these nerves in the sacral plexus. And again, most of these things are mechanical in their origin. That's why exercise and physical therapy are very, very effective in dealing with them. So that essentially is an overview of the topic areas and what causes and what treatments are associated with them. And today I have with me Miss Joan Goles. And Joan, thanks for joining us.
You're welcome.
What I'd like you to do, Joan, why don't you tell us just a little bit about yourself?
Okay, my name is Joni Goltz, and I came to the village here in 1980, so I've been here before I had any structural damage. Now, over the years, I've had a couple of hip replacements, and I came to Dr. Corbin because I had told a friend my back was bothering me, and she gave me a little coupon. And I went over to see Dr. Corbin and tell him that I had hip replacements and I was afraid to go to the chiropractor. Well, he assured me that I didn't have to be afraid. And the first thing he did, now this was for my case only because every case has their own little idiosyncrasies. My case, he threw away my heel lift that I had put in there myself after the last hip surgery. And he said, let's try this. And it's working out just beautifully.
Okay, so when you came in, you were having pain in the low back area and in your rear.
Yes.
And it had been going on how long?
Almost 3 years.
Yeah. Okay.
So you couldn't cure it in 1 week, could you?
Absolutely
No.
not. Now, you mentioned having hip replacement surgery. You have had both hips replaced.
Yes.
And so that is a very important thing for people to understand, is even though surgical intervention has been in your history, it does not necessarily mean that you have to be afraid of going to a chiropractor. The moving of the joints, and although I can do nothing with the hardware that is in her body, she still has to move around it. So what we do is we adapt accordingly, and we work from what situation we're dealing with the individual here. And in her situation, she's responded beautifully. So tell them a little bit about what happened when you walked into the office.
Okay. I walked into that office with that coupon, and I was greeted quite nicely, like a family sort of situation. And I was taken in for a consultation, and he told me just what he was going to do for this situation. And we had x-rays, and then I had an adjustment even that day. And then I was told that a program could help me. And I didn't really want to get on any kind of a program because I didn't understand that it took 3 to 5 years to get this way, and it would take more than an adjustment to get this straightened out. So we talked and we made friends. And then I set myself up for this program, and it is working just beautifully. But I want to add, though, that I didn't realize the exercise was so important along with these treatments.
Absolutely.
Yes.
Absolutely. And that's one thing that is very critical for the way we try to approach things in our office is we look at the whole body and the whole person. And in these conditions particularly, we're looking at mechanical issue. So we have to have essentially a self-imposed mechanical intervention. And that is not only what I as the chiropractor am able to do, but also what she is able to do for herself, because ultimately it's her body healing itself. And by her understanding that, you know, this got here due to what she had asked her body to do, only way to get it to change is to ask her body to do something different. And like she's already related to, her results have been quite remarkable.
Yes, very good.
Very, very much. So, so now you've been doing this now for a couple of months.
Yes.
And we've got a little bit more to deal with. Mm-hmm. But the exercises, I know you've had a lot. You've even gone as far as to teach them to some other people.
Yes.
Tell a little bit about that.
Well, I'm over the hill a little bit, and so I deal with people that are over the hill. And I say, well, I'm going to show you how to do the plank. And they say, well, what is the plank? And I didn't think I could do it, but I can do it now. And it's been quite fun. And also, several people have said, have you lost weight? And I have not lost weight. I have not lost weight.
But you're moving better and feeling
Yes.
better, and it's showing through in the way you present yourself to other people. Mm-hmm. Okay. Today we have talked a little. We have covered a couple of topics. We have covered restless leg syndrome, and we have talked about sciatica. Joan is so fabulously given us her story about how she has dealt with it and the successes that she has seen, which is just a small sample of how these things, most things that people deal with, can be dealt with in a very effective, side effect-free way. And therefore you're able to treat it in a very active way. We've learned a whole lot covered a whole lot of information today, and so I would like to invite anyone that has any questions about general health concerns, specific issues, to write in or call into the office, and there will be a thing at the end of the program to show you where to do so. I would like to leave you on the question that we had one question sent in today, and I left it there, but it was from Elizabeth, who is a Bella Vista resident. And Elizabeth wrote in and said she's been dealing with migraines for many years and has been taking medications, and she asked basically, does she think that chiropractic could help in any way? And what I would say to you, Elizabeth, is the first thing we have to do is figure out exactly what's going on, but chiropractic and manipulative therapy have been shown very good success rates in the treatment and management of migraine headaches, and those types of things have been shown to be dealt with very effectively through chiropractic care. I would like to thank my guest Joan for being here.
Thank you for having me.
And we're going to take a little break, and we're going to show you a little bit of the exercises which we've been doing with her. Okay, we're going to go over a few basic fundamental rehabilitative exercises associated with the conditions that we've talked about of restless leg syndrome and sciatica specifically. And so those are lower half involved things. So we're going to start with Joan down on the floor. And a lot of things we can start off in that position. So